Well, I tell them that I'm seeing very similar results to what I saw with traditional flap surgeries in terms of stability long term. Most patients do really well long term. There's always a few that need retreatments or their bodies just don't heal as well as everybody else, and frankly, that's why they have the disease to start with. But comparative to traditional surgery, I tell them that I see similar results long term, but the pathway to get there is much better. It's so much more conservative. Patients accept it so much better. Post-operative pain is so much less. We don't have the recession of the tissues. We don't have the long-sensitive roots. All the classic reasons why we want to do this. But the people that know that they need treatment, if it's a choice between traditional flap surgery and laser surgery, it's really the rare patient that chooses not to do the laser surgery. It's an easy decision for most of them when you lay out the process for both procedures and the pros and the cons for both. Most people would rather go the more conservative route. So I'd say in that sense it's pretty high acceptance. It's hard to know how much to believe, because certainly, especially at that time, this was not mainstream, and this did not get a lot of credibility with periodontists especially, or any of the main organizations in dentistry. It was a little bit of a leap of faith to come down and get trained 10 years ago. Now it's a different era, and there's a lot more, for sure, interest, if not straight up acceptance, by most of the periodontists I know. A few are using it. The ones that aren't using it are asking me about it. So yeah, it's a different era now. Now I'm very comfortable with it. I've done it hundreds of times, and I have pretty consistent expectations on how it's going to go with the patients. I can really comfortably guide them through what I think is going to happen and how things will go for them. But it's been 10 years, and I wanted to see if there were little updates on techniques or procedural applications that have come along in the last 10 years that I wasn't aware of. So it was interesting to be here all day and to catch up on all of that. So many things are the same. The procedures really run the same way, the same strokes, roughly the same settings with the laser. There was a lot of continuity. It's like they say, the fundamentals don't change.